Hi, my name is Natasha Yoki, and this is part one of my musculoskeletal exam. Um, Hi, my name is Natasha Yoki, and I'm an FNP student, and today I'll be doing a musculoskeletal exam. Can you please tell me your full name and date of birth?
Virginia Yoki, 3258.
Perfect. I'm just going to do some hand hygiene over here. Okay. So first I'm going to start out by looking at your hands. As with all examinations, I start with a visual inspection, looking for symmetry, any obvious deformities, nodules, growths, or areas that look clearly inflamed or swollen. Next, I will start off by palpating. I start in the interphalangeal joints, feeling for any pain or crepitus. Is there any discomfort here?
No.
Okay, moving into my interphalangeal joints here, checking for nodules, bumps, any crepitus or discomfort here. And then into the carpal joints of the wrists. Same thing, feeling for nodules or any discomfort there. Okay, next I will do range of motion for the fingers. So flexion is straight out, and then extension is back. And that looks great there. Then we'll move into the wrists. So flexion, extension, and then we'll abduct and adduct. So adduct is away, and then abduct is towards you, but just with the wrists.
Okay.
All right, good. You can go ahead and relax there. Next are a couple of specialty tests for carpal tunnel syndrome. So I'll take your wrist here and hyperextend it, and go ahead and just kind of relax it, and we'll hold it here hyperextended, and I tap on that on the carpal tunnel, and if there elicits any pain, then that is indicative of carpal tunnel syndrome. So, any pain or
No.
pain in there? Okay, good. Next is Phelan's test. You can do it two ways. You can do it in a prayer hand position like so, or you can also do it with two wrists together. So whichever you prefer. And you'll press your hands together for 10 seconds and holding moderate pressure. And then if that elicits any pain or tingling, then that is indicative also of carpal tunnel syndrome. Okay, you can go ahead and relax. Next, I'm going to be moving up on into the elbows. Once again, always starting off with inspection. I am looking at the olecranon process here. Also the medial epicondyle here and lateral epicondyle here. I'm feeling for any tenderness or pain. In either of those places would indicate epicondylitis. Let's see, so in the medial epicondyle, if there's tenderness there, it can indicate golfer's elbow, or laterally is seen in tennis elbow. Any pain here?
No.
Good. And I'll come over onto this side. So olecranon, medial epicondyle here, and lateral. Good. I'm always looking for symmetry between the two, and no swelling or obvious growths or nodules in either of those. Next, we'll do range of motion in the elbows. So just flexion here and extension. Good. Again. Good. Great range of motion. So from the elbows, I'll be moving up into the shoulders. I like to start off first with a visual inspection, looking for symmetry and evenness in their length, and no swelling or obvious signs of inflammation or redness. It is always ideal to have to want to look at your patient's skin, but in this case, I'll just have you keep your shirt on. So next I move on to palpation, and I always like to start here in the sternal notch and just kind of move up the clavicular line until I reach the acromioclavicular joint. And from here, you can tell if there is tenderness in or any sort of effusions or bursas forming by any noticeable bulging or swelling or pockets of fluid, which I don't feel there. Come on and do it on the other side. Clavicular line here, acromial joint. And then feeling biceps here. Good. Next, we'll assess range of motion in the shoulder. So you can go ahead and take your arm and just move it across your chest, like so. That's adduction. And then away is abduction. Good. And then try it on the other side. So bring it across your chest and then out. Good. We can also check internal rotation and external rotation. External rotation would be grab your arm and then reach behind your head and try to grab for your spine there. Good. And this is active range of motion. You can always do passive range of motion for your patient, so you can relax here. And then I'll go ahead and do that movement for you. Looks good. And then we'll do it on the other side. So up and back. That is external rotation, and then internal rotation would be having your arm and then reaching behind you and reaching up this way. And that's internal rotation. Very good. And then again on this side, internally rotate and then back. Excellent. Okay, so noticing in this test for any sort of limitation, any specific movement that elicits pain, and of course numbness or tingling, anything that makes it truly uncomfortable to do. There are a couple specialty tests to look for any rotator cuff injuries. The first one is the Hawkins test. So I'll test it here on the right side. So go ahead and put your arm like this. Hold it. Yeah. No, you can just hold it. Or excuse me, don't hold it. You can just go hold it up without assistance. And I'm going to secure the elbow here and then lift up kind of on the shoulder joint. And if there's any pain, if that eliminates any pain here,
repair products for the lamp up there. Okay.
That would indicate a shoulder cuff injury. And on the other side here, any pain there? No. Okay, good. So go ahead and relax. Next, I'll do the empty can test, which is another test for rotator cuff injury test. So go ahead and hold both arms out at about 90 degrees, and they will be lateral flexed. And I'll go ahead and put pressure down on both of these and resist pressure. Very good. And if there is any weakness or any inability to hold the strength, it is indicative of an injury there. You can also do the drop arm test, which you would have your arm out at about 90 degrees, and I will secure it here. And any inability to hold this once I release my hands is indicative of a tear in the supraspinatus ligament. So go ahead and relax your hand here into my arms. And relax. Good. So if the arm drops, that would mean it's positive. And then on this side, same thing. Go ahead and hold. Good. That is the drop arm test. Next is the near impingement test. So I have one hand here on the scapula, and I'm going to go ahead and have you raise one arm up. Good, as I'm putting pressure here. And then also this side, good pressure. Good. Any pain?
No.
Okay.
It's good massage.
Yeah. Okay, next I'm going to move to head and neck. So range of motion in head and neck, lateral, side to side, flexion, extension. Okay. And then I'm going to test your temporomandibular joint here. So any pressure, go to open and close. Any clicking. And side to side, go side to side. Okay, good. Relaxed. So looking for any clicking there or discomforts. So next I'm going to do the Sperling test, which is a test for cervical irritation. So go ahead and tilt your head to one side. So tilt your ear to one shoulder. Good. And I'm going to put light pressure and let me know if there's any radiating pain here. Pressure, any pain?
No.
Okay, and then to the other side, ear down. Pressure, and there should be pain elicited down that side. Did you experience any radiating pain or sharp pains?
No.
Okay.
None.
Next, I'm going to check your spine. So go ahead and have you stand, please, and face this way. I'm always starting out with my visual inspection, looking for the concavity here of the cervical spine. Also, any deviations of the spine, alignments, any lordosis or kyphosis, which I don't see. Also, concavity coming back down into the lumbar spine, ending here at the sacrum, which all looks good. So checking my sacral junction here, checking that it's even in the top of the pelvis, the anterior posterior sacroiliac joint, and that is nice and even, which would indicate any leg length discrepancies. For range of motion here of the spine, I will have you bend forward. Very good. And here, this is a really great place to check for any unevenness here in the spine that is seen with scoliosis. Everything looks great there. You can come back up. I will also palpate the spinous processes. So starting here about C7, you can kind of go down the spine where the spinous process is sharp. Also going in between this way. The intervertebral spaces, and seeing if there is any pain elicited in a certain area, which could indicate fractures. Okay, good. So we did forward flexion. Let's go ahead and do extension. So lean back for me. Get it in the spine. Good. And then go side to side. Perfect. All right. That concludes part 1 of my musculoskeletal exam.